And the first key message is obesity is really a major crisis. I mean, it's really, in terms of the prevalence, it's increasing. I mean, already every other person in Europe is either overweight or obese. And projections from the WHO actually show it's going to be an even bigger problem in the future. So in the next 20 years, for example, in Ireland, there will be 89% of the population will actually have obesity or be overweight, up from 72% now. So it's a massive increase, and that's replicated across Europe, and it has major economic costs. I mean, the OECD says 1 to 3% of all healthcare expenditure is spent on obesity. In countries like the UK, it's 6%, Spain 7%. It has massive economic costs, lost productivity, disability, not being able to go to work, and these kind of things. So the economic costs are huge, and Europe already has a fiscal problem, so this only adds to that. But currently, the policy to really tackle obesity is focusing on prevention. So it's a lot about lifestyle changes, behavioral change, taxation of the food industry, and these kind of public health messaging. And to some extent that's working in many countries, but it's only really tackling the problem for healthy people. So trying to prevent healthy people from becoming obese. And what we have found in our study, interviewing experts, also from the medical profession, is that obesity is really a disease. It's a complex disease. And focusing on prevention alone will not actually tackle the whole problem, because there are people that are already severely morbidly obese and they cannot be helped with prevention. On the contrary, those people will be stigmatized, because people will tell them, you have to change your lifestyle and you have to be slim again, although that's impossible for them because they're already severely obese, and it's a disease, as our interviews in our report have shown. So for those people, the strategy would be to look at the best treatments. So policy on treatment, things like medical medications, weight management training, and these kind of programs, and also bariatric surgery. So there's lots of things for a comprehensive approach that could work. Some countries like France have done this with the French obesity plan, but there's really a lack of a comprehensive approach to look at prevention and treatment together.